Hi everyone, and welcome to Medicines Management Refresher Training. Today you're going to revise your skills by watching a video clip where it is June 2050 and Hannah Little is being assisted with her prescribed medications. This video demonstrates current practice and will be updated as necessary. After the video, you will be given a date and time, also in June 2050, and asked to role play assisting Hannah with her medications, following the directions on her medication instruction sheet. This year there is only one station and you will be required to assist Hannah with quite a number of medications. However, if you were required to assist with more than 3 medications out of the original container during a real visit, you need to contact your supervisor.
Good morning, Hannah.
Hello, Sheila. How are you?
I'm fine, thank you. And yourself?
Great, thank you. And what sort of morning is it about this morning?
A lovely bright morning.
Oh, good.
There's no rain.
Good. Sheila, this is my daughter Brea. She's home from London.
Pleased to meet you, Brea.
Me too, Sheila.
She wants to ask a few questions just about the tablets that I'm on. Is that all right?
Fine, no problem at all. Well, I'm Sheila McCamley and I'm a domiciliary care worker and I work with the Trust, and I'm here this morning to help your mummy with her medication.
Okay.
So if you don't mind asking questions, can I go ahead?
Oh, absolutely, thanks. Yeah.
I'll give my hand a wee wash before I start.
Okay. Thank you.
Right, I'm just going to check your care plan book, Hannah. Can I check your date of birth, Hannah?
Yes, I was born on the 24th of April 1963.
Grand. And I'm just going to check and see if there's anyone in since last night.
No, there's nobody in. Mary came in last night. She had me to bed.
Grand.
She's very nice.
Grand.
What about Mrs. Ross? Sheila, she used to look after me when I was little. And how is she?
I'm very sorry, Brea, but as trust policy we do not talk about other service users. Alright?
Well, that's right. I wouldn't want somebody talking about me.
I'm just going to check your medication instruction sheet and see what you have to get today, this morning.
Okay.
These look very complicated. Can you explain them to me?
Well, they're colour coded each time of the day you're in, and you just go according to the time of day,
Right.
and you just read it across. And I'm in the morning, so I'm just going to follow that right across.
Okay.
I see you have medication to get from your blister pack,
Mm-hmm.
and I'm just going to check the details on your blister pack.
Okay.
Your name and when it was dispensed and the details inside from the pharmacy has your name on, and I'm just checking that the blister pack is intact in the front, and you have 4 tablets in the morning and 3 at night time, which is grand, and the back is intact as well, so I'm just going to give you your morning tablets.
Okay.
Okay.
Would you not be afraid of spilling them, Sheila?
Well, I have a wee bowl here on a firm base and I like to press it out from the front. You can turn the blister pack round and open it and take them out, but you have to be careful not to touch the tablets because they wouldn't want them to absorb into your skin, and there's a chance of opening the wrong section. So I'm just checking that I've got all the tablets out because some of them can stick in the wee plastic. Alright. Now Hannah, your 4 wee tablets. Have you a wee drink
I
there?
have. Yeah, thank you.
Is that water alright? You
Oh,
want
it is not at all. No, nice grand. Yeah.
Alright. Right, Hannah, I see you have Bucostin 3 milligrams, 2 tablets to get for nausea. How are you feeling this morning?
Oh, I do feel very sick. I was sick all night.
And you would like me to give you
I
the
would
2
please.
tablets?
Thank you. Yeah, thank you.
And it says here to put them between your lip and upper jaw. Are you happy to do
I
that?
have. I've done that before. Yeah.
I'm just going to check.
If Mum's sick later on, Sheila, could I give her 1 litre?
No, it's best to stick to the instructions. If you feel that they're not working, you must speak to your doctor, Hannah.
Okay. No.
So I'm just going to check the label on the bottle and the instructions on the medication instruction sheet that they match. Okay. Right, so I'm going to give you 2 wee tablets. Right, can you place those?
No bother.
Okay.
So if Mum couldn't do that, how would she get them?
I could put a glove on and help her. Alright, thank you.
Would it make any difference if she just swallowed them?
need to follow the instructions on the label. It may not work properly if she swallowed them.
No, that works. That seems to work right.
Right, Hannah, I'm just seeing now you have lactulose to get, so I'm just going to check the label on the bottle and the instructions on the medication instruction sheet here, that it all matches, and it has the date of when it was dispensed and the expiry date on it. And you have 15 mils to get, so I'm going to give you 15 mils of your lactulose. I'm just going to give the bottle a shake and put the label of the bottle in the palm of my hand and make sure that I don't drip any, that it would wipe off any of the details. $15 mils. I'm just going to check it, put it down the table to check if it's the right level. Alright. Now Hannah, are you happy to take that now?
Do you know, I don't think I will. I think I'll leave that later because I did go this morning, so I'll leave that later.
No, I prefer if you took it now. We're not allowed to leave out medicines for you to take later, Hannah, because it has happened that you mightn't take it later, might take it too close to the next dose, or forget to take it, and then there's danger to grandchildren.
Oh, okay. Well, alright, then I'll take it now then. Okay.
Now, Hannah, I see you have cream to get in your elbow, you have eye drops to get in your eye, and you have a patch to get on. And I'm going to do the eye drops first to reduce the risk of infection to your eye.
That's okay.
Alright. Natural tape. I'm just going to check the details of the label on the bottle matches the instructions on the medication sheet here. So the natural tears, and it was opened on the 2nd of June, and this is the 6th of June, and it has the your name on it and the expiry date on it.
So why did the lady write on it yesterday? Right on the bottle, you know, when she opened it.
It says here, bring it to be used within 28 days, so we can't use it any more than 28 days, so it lets us know when it was first opened.
I see.
Okay? Right. Now I'm just going to check the procedures. That's grand. Now, are you happy enough, Hannah, to tilt your head back? Right, I'm just going to give my hands a wee wipe with the gel. Or put on the gloves. I'm just going to get a wee wipe here. Now, Hannah, it's your left eye, just double check, it's your left eye, so your left eye is my right, so that's where the mistake can happen. Right, so I'll just hold it down. I'm just going to drop a wee drop into the middle of your lower eyelid. Alright, right, just close that a wee minute, let it dissolve. Now, if your mum had to get another drop in it, I would have to wait a minute or two before I could do that without it sprayed. Or if she had a different eye drop or cream to get in, I would have to wait up to 10 minutes depending on the instructions of the procedure.
Right. You alright?
Yeah.
Just hold that.
Nobody likes getting something in their eye, but I mean, that's grand.
That all right?
You're good at doing it.
Right, that's grand. I'm just going to put the gloves in. Yeah. Now, Hannah, I see you have a few bit cream to get applied to your right elbow, and it is to be applied for 7 days, and this is the 6th, so it stops on the 11th.
Okay.
So I'm just going to check the label of the cream matches the instructions here on my sheet, right? And I'm just going to check the procedure.
You have an awful lot of checking to do.
Yeah, just to keep ourselves that we're doing it correct. All right. Now I'm going to give my hands a wee cleanse before I put on the gloves.
It's all very professional, isn't it?
time did the children say they're coming?
In the afternoon.
Now, Hannah, it's your right elbow.
That's right.
That's your left, Hannah. Can I have your
Oh,
wee?
I'm open. This one. That's right.
Lovely. Still a wee bit red.
It is, yeah. I'm not sure that cream's working. You know, I got other cream in the or Brea got me other cream in the chemist. What do you say? It's supposed to be very good. Could we put that on instead?
I'm sorry, I can only put on what cream is prescribed. That may have a different effect on your elbow.
Okay, well, I'll try it for another round then.
Right.
Okay.
So I can go ahead then.
Go ahead.
Right. So it says to apply thinly or sparingly on your elbow, so it's just a small amount.
So how do you know how much to apply, Sheila?
It says on the instructions to apply thinly or sparingly, so that means a small amount. So just keep your sleeve up for a minute to let that absorb in.
Yeah. Okay.
Now I'm just going to remove my gloves and cleanse my hands again.
Yeah, all right. Well,
Yeah.
How's that feel?
That's grand. It's lovely, yeah.
Now, do you want to pull your wee sleeve down and give your hand?
Yeah. No, it's grand. Thank you very much. Lovely, thank you.
Anna, we're nearly finished. I see you have a patch to get on today.
That's right.
The new Pro patch. And it's not to be applied in the same area for 14 days. So I'm just going to check where it's been last applied. Okay. Fine. And I see it's been applied on your left shoulder.
Oh, that's right, yeah.
Right. So do you mind if I put it onto your right shoulder area this time?
No, that's fine.
I'm just going to check the different areas that can apply to make sure I've got it right.
why does it need to be moved to different areas, Sheila?
Patches can cause skin irritation, and some people their skin does become very inflamed, so we wouldn't put a patch on. In that case, I would report to my supervisor. So by moving it around, it gives it a chance to be healed.
You asked enough questions.
Can I just check, did you have a bath this morning?
No, I just had a wash at the sink.
Grand, that's grand. Right.
Would that matter if she had a bath?
Yes, because it will absorb quicker into the skin than it should be. I'm just going to now, just going to check the details on the label, matches, and the expiry date. Yes, June 51. And so I'll give my hands a wee clean before I put on the gloves.
Does the patch help one?
Oh, so it's very good, yeah. You can know it's on. It's very good.
Just going to put the wee date on the patch. And this is the 6th. Grand. Now I'm just going to remove your patch. Hope you don't mind, hope it don't help
No,
you.
that's all. Go ahead.
I feel okay?
Mm-hmm.
Yes, your skin looks grand, it's not red and inflamed.
Okay.
And just turn it inwardly, lovely. Now, just put it on here.
Mm-hmm.
I'm not pressing down too hard on you.
No, that's lovely.
Right.
That's very good.
How's that feel?
Lovely, yeah, thank you.
Right.
Great,
Right.
great. That must have been near finished now.
Yes. I'm just going to remove the gloves and then cleanse my hands. And then I just have to.
There's a lot of hand washing.
Yes, we just have to protect ourselves and protect the service user. Now, are you happy enough now? I'm going to write up all what I've done.
Yes, go ahead.
Right, that's me finished writing up all my details. I'm just going to close the care plan book and tidy up. Now, where would you like your medicines put for safety, Hannah?
They always put them up in this cupboard here, so
Right.
that's
So
good.
put them up there
Yeah,
today.
please.
Right, grand, no problem at all. Just want to make sure I don't drop anything. And your drops, some drops can be stored in the fridge, but yours can be stored at room temperature.
Okay.
And your care plan book, where can I put it for confidentiality?
We'll just put it in saying there's room up in that cupboard too, so we'll just put it up there too.
Put it up in the high shelf.
Yeah, thank you.
Right, grand, no problem at all. Right, that's it up there.
Okay.
And Bria, can I give you the bag here to put it in, please?
Oh, sure, yes. Okay, then.
I'll just give my hand to the chair before I go.
It's lovely to meet you, Sheila. So I'm here for a few days, so I'll probably see you tomorrow.
Very good. There will be somebody later on, because I'm finished now this morning after my morning calls, so there'll be somebody in later on then to do. So I hope you have a nice day.
Okay.
And you enjoy your day and enjoy
Thank
your
you,
grandchild.
Sheila. Thank you very much.
Thank you
All the
very
best.
much.
Thank you.
As I'm sure you noticed in the video, one of the changes this year are that you always wear gloves when instilling an eye drop or applying a medicated patch. Another learning point is that if you're applying a cream or patch as well as instilling an eye drop, you should instill the eye drop first, as this reduces the risk of infection to the eye. Can I take this opportunity to remind you that if you make a mistake with medications, you must always contact your supervisor. For example, if you've removed tablets from the blister pack from the wrong day or time of day. I know it is tempting to try and sort this out yourself, but this always leads to more problems. Some people are prescribed a once weekly medication to strengthen their bones, which has to be taken 30 minutes before breakfast or other medications. Please look out for this and contact your supervisor. Also contact your supervisor if there's more than one medication instruction sheet in the care plan book, or if you notice a lot of medication in someone's home. Today you will be asked to sign that you feel confident to carry out these tasks, and spot checks are being carried out. Disciplinary action will be taken where staff are not adhering to what they've been taught. Please take a few minutes at the end to complete an evaluation. Thank you.